asked to be on a call at 10:15. So I'm going to hand it over to Matt after I make some comments. So first off, we are excited, very excited about this report and the information that's involved in it and the big areas that we're going to focus on as a state in tandem with TennCare. And as you all remember, that was really what was very important to us, was to be able to have TennCare at the table with us, because we knew if we had them at the table with us, that would make this report even more meaningful. So with that, a couple things. Matt will go over the overarching themes in the report, but just to give you an idea, for those of you that did not watch the budget hearing, you will note that we went ahead and requested a lot of money in the budget hearing related to the report. Part of that was a community provider cost of living adjustment, which is like 35 million, which would be amazing. Then the 10 million recurring request for the workforce development, which includes ideas like the public behavioral health sign-on bonus, the public behavioral health internship portal, and then the public behavioral health scholarship program, all of which we would want to utilize to bring people into our field and get them interested. The other thing I wanted to tell you that we've done is we put in a grant to National Association of State Mental Health Program Directors that is with SAMHSA, where we're asking for funding to have some high school recruiters, people that would go out and speak to seniors and freshmen in college to say, hey, have you ever considered wanting to work in the social service field? And hey, all this great information that we had in the workforce development report around what your average salary is in your county that you've come from, did you know social services pays you more than that? Trying to sort of switch the clip there from people thinking, well, I can only make good money if I go into business or something like that. Actually, if you look at what people in your county are making, if you went into this field, you would actually make more. So again, trying to flip that script and make sure that youth understand there is a pathway and you get to give back to people and make a difference in people's lives. So I'd like to open it up since I've only got 10 more minutes for any kind of questions or comments y'all have about what we've done with TennCare. You know, they've also asked for an increase in their budget. So I want y'all to know that all the effort actually got us results related to real actionable items that we did not wait for this report to come out for. We knew enough working together. And again, Matt Yancey and the team just did a phenomenal job. Ricky, you were part. Albert, you were part. So I know that anything y'all want to say about the report and the work group, I'll turn it over to y'all.
Commissioner, this is Debbie.
Hey.
So we know what you put in as we've seen the budget, and you just said that TennCare asked for an increase. Was theirs to follow similar to what your request is? How is the TennCare part of, how will that work?
Yeah, I think it would be best. I don't want to speak for them, Debbie. I go back to their budget hearing. Kurt, if y'all can look at where it is in the clip when they talk about this, I'd rather you hear straight from Stephen. It is different. I can tell you it's different than ours because obviously they fund MCOs. We don't. We fund you all directly. So it's, you know, they have a different way in which they're going to do this. But I'd rather, if it's okay, Debbie, I don't want to misspeak. I'd rather y'all just look at what Stephen had to say.
Yes, ma'am. Thank you. I appreciate that.
Absolutely. Thank you for asking, Debbie.
We'll find that clip and send that out to
Thank you
and the rest of the group.
Thank you. Albert or Vicky, anything y'all want to add before it gets turned over to Matt?
Well, I'll let Ricky go first, if Ricky, if you like.
Thank you, Albert. Sure. First of all, huge kudos to you and your team, Commissioner, for the work on this. Definitely see the traces of all the feedback and what you've put together. A huge ask for the governor, and we are holding out hopes and throwing up prayers, hoping for the best. So thank you, thank you, thank you.
That's good. That's good. Holding out the hope and throwing up the prayers, and maybe doing some letter writing might be always good. Obviously, I can't say anything. I'm just, musing here, but yeah, all's good. Kurt, I didn't cross the line, did I?
You didn't. That line is
Thank
in front of it. That's good.
Assistant Commissioner Hippel, I don't want to cross the line. Albert,
Yeah, Commissioner, what I would say is this: the process, you actually had to be there to see the process. It was a really focused process, tedious process, and every area was covered to try to make sure that everybody got something that they wanted. And I was really impressed by that process. And thank you for having us involved in so many other different factors involved in that process, as well as your leadership.
well, thank you, Albert. Again, Matt Yancey really was our point person on this, with Mary Shelton at TennCare, and of course, Matt's team with Kurt and Matthew and Jess, and I can't remember who else participated, Matt, but a lot of kudos goes to Matt for his lining out the whole way that this would move forward. We are fortunate, guys, to have Matt as deputy commissioner, and we're very fortunate to have the leadership that's on this call, Kurt Hippel and Avis, and I'm not seeing Matthew, period. I mean, we've got a great Kirby Fry. We've got a great team at our department. I'm just really proud of them. Can't say enough. Cannot say enough. So Matt, I'm going to hand it over to you, and y'all, I'm going on this next call. Look forward to seeing you soon. If I don't, Merry Christmas, Debbie. I see your tree's already up. I'm behind.
There, I was telling them earlier, Commissioner, that 7 of the 8 trees.
Lord,
But the eight trees, the 8th one is not going to get done. It's upstairs, and after ankle surgery, upstairs is off limits.
I understand. Well, I'll tell you what, Chris Jernigan also, who's on this call, can do some trees, Christmas trees. And Chris, I was supposed to put mine up this weekend, and I did not. That's why the video's not on. I'm ashamed. I feel ashamed. Hey, y'all, I'll see you. Thanks, Matt, for carrying it on.
Thank you.
Commissioner.
Bye. Bye-bye.
Thanks.
So Debbie, is that one of those Christmas trees that has the white snow on it, or is it just, what kind of tree is that?
It is.
Nice. My
It
daughter
is.
and I played a joke on my wife last night. She bought a live tree that she kept outside overnight in the driveway, I guess, to let it, whatever it does. And my daughter and I hid it.
Oh,
behind the
no.
house. Yeah. And we told her someone stole it.
All she's going to do, Matt, is go out and buy another one. And you're going to be out
That's
the
what she
money if you
said.
don't cough it
She
up.
said, I'm gonna go right back and buy another one and send you the bill. So then I brought it back from around the house and said, no one stole it. Here it is. Anyway, it's good to see everybody. I think what we're going to do is hit the high points on the report. We're going to disseminate it to everyone next week. We're going to meet with the actual workforce work group one more time to go over the final report, and then we'll send it to each of you on the call today and disseminate it broadly across the state. But just wanted to spend maybe the next 15 minutes hitting the high points. And
Excuse me, hey, Matt, would you like me to share the screen and share that report?
why, yes, that would be
Okay,
perfect.
here we go. Okay.
Yeah, let's do it. Let's do this.
All right. Can you see it?
I can't.
Okay. You can see it?
No, not yet.
Not yet.
Okay. Sorry. Excuse me for a
No
moment.
worries.
No
This
problem.
happens to
Matt,
everybody. Yeah.
Matt, while we're waiting on that and Amy's working through that, can we just do a quick, Kirby, if you do attendance, if you can, just a little housekeeping before we continue on. I wanted to make sure Commissioner had time to get in and make her comments and open it up to questions before she had to leave. So while we're waiting on that, Kirby, would you mind doing that so we can have an account of the attendance, please?
Sure. Hold on one second. So I have, so I know Commissioner had to get off the call, but I have her included in the attendance. Hold on one second. Why is my computer acting funny?
That's
Okay,
okay. Can you get it? If not, I can help you out. You got it?
I have it. Here we
Okay.
go. So Deputy Commissioner Yancey, Kurt Hippel, Chris Dosser, Jernigan, Avis Easley, Matthew Perriott, Amy Holland, Kirby Five, Albert Richardson, Ricky Harris, Shara Biggs, Debbie Hillen, Amber Hampton, Gail Lodato, Jan Cagle, Mary Nell Osborne, Samantha Slagle, Richard Barber, and Dina Savanos. Did I miss anyone?
You guys, I am having a problem here trying to share this screen. We can see it
Amy?
now, Amy.
Yeah, Amy,
Matt
I
is
pulled it up.
sharing it.
Okay, I
You're good. Amy,
you
we're
got
good.
it? Okay,
We got it.
great. Thanks, man.
Okay, so let me run through some of the high points here. And at any point, if anyone has questions, please let me know and we'll do our best to respond. So again, this is the Public Behavioral Health Workforce Work Group, Strategies for Meeting the Need in Our Communities, this dated December 2021. And as the commissioner said, you know, this was a work group convened by both our department and the Division of TennCare. Just really quick, you can see how the report is broken out through the table of contents. We thought it was really important, or should I say the work group thought it was really important to provide some clarity and some definition around what actually makes up the public behavioral health system. And when you see the report, you'll see how that really speaks to the broad continuum of care that we support, from prevention, early intervention, treatment, and recovery, and really a system that targets to support people who are uninsured, indigent, or covered by Medicaid. We go into the report as far as what type of professionals work in the public behavioral health system. We provide data related to the increasing need for behavioral health services, not only across the country, but in Tennessee, and then speak to increasing pressures on the workforce. And really the bulk of this report are the strategies that were identified by the work group members. And then you can see we end with a conclusion and next steps. The report starts with an executive summary that just does some table setting around this issue. As you can see from this excerpt here, you know, we highlight that there are significant pressures on the workforce that coexist, that are being exacerbated by increased need around behavioral health services in Tennessee. One of the themes in the report is obviously the impact of COVID-19, the pandemic, and how it's impacted our system here in the state. So this is the executive summary, and of course, I'm not going to read through all of this, but you will see it next week. As the commissioner mentioned, we convened the work group back over the summer. And for those of you who work closely with me, you'll know that I like the number 3 and I like the number 5, and I try not to do anything more than 3 or 5. So we met 3 times and we had 3 goals, and that seemed to work out pretty well. Here you can see kind of a snippet of the highlighted strategies that I'll go into more detail here momentarily. But as you can see, they're kind of themed out based on reimbursement rates for people who provide public behavioral health services. Strategies also include licensure modifications, benefits and incentives. There was a lot of focus on pipeline planning and trying to wrap our minds around how we not only shore up and support the current workforce, but what can we do as a state to enhance pipeline planning into the public system. There's strategies that are related to diversity and inclusion, student loan forgiveness, internship opportunities, as well as efforts to communicate and do outreach to potential students in Tennessee. Moving on from the executive summary, the report goes into an introduction. Again, doing more table setting around the system in Tennessee. As you can see here, we wanted to make notice and provide some recognition to the advancements that the public behavioral health system has observed over recent years. We give some examples here related to Tennessee Health Link, to the statewide crisis system, to all of the work that's happened around supportive housing over the years, substance use disorder treatment. We've got a really special system in our state. We also reference the partnership between our department and the Medicaid Authority, TennCare. That is something, and we talk about this a bit, you don't see that in every state. And like just yesterday, we were in a meeting with TennCare with one provider. We are working very cohesively and collaboratively with the Medicaid Authority in the state related to the public behavioral health system. Here's a quote from HRSA. There's a lot of HRSA data that we used in this report. HRSA, of course, is the Health Resources and Services Administration in the federal government. As you can see here from this quote from HRSA, future supply and demand for behavioral health practitioners is going to be affected by a multitude of factors. They reference the aging of the nation's population, population growth, economic conditions, the expansion of insurance coverage, changes in healthcare reimbursement, retirement, attrition, availability of training, geographic locations. And these are all things that are, even outside of the aforementioned pandemic impact. I mentioned the 3 goals. This is what really drove the work. So the first meeting of the work group focused on this first goal, and that was to clearly identify gaps and needs related to the public behavioral health workforce using relevant national data and data specific to our state. The second meeting was really around developing strategies. We led some pretty good exercises, and then we sent people home after the first meeting with homework to come back with well thought out strategies for the consideration of the work group. And that, again, that's where we spent our time for the second meeting, assessing for strategies to address identified gaps, including proven action steps to support recruitment and retention of the public behavioral health professionals in the state of Tennessee. And then, of course, the third goal was compiling and putting together what we're reviewing right now. And that's a report for key decision makers, which will highlight identified gaps, but more importantly, will offer effective short-term and long-term strategies to address the public behavioral health challenges in Tennessee. And as I said, next week, we'll be disseminating the report broadly. Each of you will have a PDF version of it. Please help us in sending it out to key stakeholders within the behavioral health system in the state. As I mentioned, we spent some time in the report talking about what is the public behavioral health system. We highlight various levels of care, including crisis stabilization, inpatient psychiatric services. We also reference those critical recovery supports that each of you know how important it is to have in place for people, including supportive housing, supportive employment, peer support, care coordination, case management, also reference some of the varying levels of care related to substance use treatment. I really like this quote, and this is from, gosh, 20 years ago. I think this was George W. Bush's New Freedom Commission on Mental Health back in 2002, but it states the mental health delivery system can only be as good as the practitioners who staff it. And certainly y'all know that as providers, but to me, that's kind of a key message within this report. We reference here the types of professionals that work in the public behavioral health system. And this is really important because it's not just counselors or therapists. It's also non-clinical professionals, folks like case managers, peer support specialists, recovery coaches. So we really wanted to take a broad approach and speak to a broad overview of who are the professionals that make up the public behavioral health system. And it's not just prescribers, it's not just clinicians. There's all these other really important roles that we need to figure out how to better support as we move forward. Several of the pages within the report underscore the increasing need for behavioral health services. We reference several Kaiser Family Foundation data points that speak to increased anxiety disorders and depressive disorders across or over the past 16 months or so. We also reference data that ETSU put together last year at the beginning of the pandemic related to Tennesseans and some of the struggles that they were facing at that time related to the pandemic and behavioral health. There's also a bunch of CDC data here in the report. We go on talking more about the increasing pressure of the behavioral health workforce. Again, referencing some Kaiser Family Foundation data related to certain positions within the workforce and shortages related to them. There's again more HRSA data. Here's a map of the state where you can see health professional shortage areas specific to mental health. And the whole state, for the most part, is covered in blue. And there's not many areas in the state of Tennessee where there's not a shortage area related to mental health practitioners. Really interesting data here from HRSA that speaks to by the year 2030. So 9 years from now, you can see the estimated shortages for various positions within the system. Mental health counselors, over 1,200, psychologists, almost 900, substance use counselors, over 800. There's a lot of work to be done here to shore up these anticipated shortages that we expect to see according to HRSA in 2030. One of the things that the work group also looked at was the pay rates for people who work in the system. You can see here we received data from, this may be from NASW. You can see pay rates compared as it relates to Tennessee versus national averages. For the most part, Tennessee's below the national average as it relates to the average pay for social workers, psychiatrists, nurse practitioners. So the data here speaks to those pay differentials. Again, more data related to salaries is featured in this report. We also got some really good feedback related to the average debt, student loan debt for people who are working in the public behavioral health system. You can see is significant, and obviously someone with a medical degree in psychiatry is likely to have more debt than maybe master's prepared folks, but the master's level professionals on average are carrying a significant amount of student loan debt. The University of Memphis, who was also part of our work group, they gave us some specific data related to student loan debt for social workers coming out of their programs. Again, fairly significant. Let's see, I want to be cognizant of the time, so I'm going to jump into the strategies here. And as I said, the work group really wanted to narrow in on short-term strategies that focus on retention and, as it says here, re-energizing the current workforce, but also long-term strategies that speak to more recruitment for the next generation of professionals in the state. The first strategy was around employee-focused incentives. So, you know, several of these things are featured in our FY23 budget request, and you can see here activities related to sign-on bonuses to recruit and retain vital positions, and expanding those bonus opportunities for rural positions or professionals who work in underserved areas of the state. Among the colleges and universities on the work group, a lot of feedback around, we don't know how to pair our students with providers in the public behavioral health system. And is there a way to better coordinate that? And this strategy really drove what the commissioner was saying around the behavioral health scholarship program. And if funded, what we're looking to do based on the work group's feedback in this strategy is to develop stipends for people who are working in the system related to professional development, but also help prospective students, you know, not incur the student loan debt, and actually provide stipends on the front end for them to advance their education with the expectation that they work for one of your agencies post-graduation. Also looking at clinical supervision hours. I know that many of the providers in the system provide clinical supervision as a natural part of the clinic, but we're increasingly hearing that that's more and more challenging. So we're looking for ways to help people, you know, get those clinical hours in so they can become terminally licensed. The second strategy was around employee-focused benefits and doing cross-training inside organizations where feasible, and developing relationships with partnering organizations to do more cross-training. A lot of feedback and discussion around regular trainings on vicarious trauma and compassion fatigue. I think the work group members really honed in on that. That's a part of the issue. It's not just having opportunities to advance your education or get clinical hours. How can we as a system better support the professionals as it relates to the secondary trauma that they may experience from their day-to-day roles? Providing opportunities for flexible schedules. Long-term activities include sabbatical opportunities. I think we're hearing more and more about people in the public system having an opportunity for sabbaticals. Again, more cross-provider collaborative learning opportunities like Lead Tennessee, where networking and collaboration are supported. A lot of the discussion was around reimbursement. And one of the things that the work group identified as far as an activity is creating an inventory of all reimbursable services by our department and by TennCare, where both fund the same level of care. You can see the work group members recommended that the departments hire an external group to analyze service costs and reimbursement rates, and to produce a report from that external group that shows the cost and reimbursement rates to provide the services, and to analyze the cost differences across both rural and urban areas of the state. Long-term strategy, again, using the report to show the cost of providing services and develop a plan to address the continued funding for provider rates, and to address the means to provide regular rate reviews and adjustments. There was a strategy here related to diversity and inclusion in the public behavioral health workforce. This was something that the workforce group members felt very strongly about. Activities include creating a comprehensive plan for diversity and inclusion that includes all facets of service delivery and incorporates viewpoints from everyone involved. Investing in talent management for individuals already employed in the organization, recruiting a workforce that closely resembles the population served to foster mentoring relationships and the support of the community served. Strategies related to internship opportunities, and this may be what I was speaking to earlier, but really trying to figure out how we can bring more prospective interns into agencies that make up the public system, and creating this internship portal for which we can more effectively connect students with public behavioral health providers. Let's see, long-term strategies related to this specific strategy includes reviewing scopes of practice of internship levels to identify ways to expand behavioral health, pursuing the opportunity to have internship hours counted towards the number of hours needed for licensure, and again, pursuing a long-term goal of increasing opportunities for behavioral health providers to employ interns as they graduate in professional bridge programs in provider shortage areas. So when you get this next week, you'll have the opportunity, obviously, to go line by line, but this really speaks to what we're trying to accomplish in more effectively partnering with academia and bringing more people into the public system while they're in school, but also post-graduation. There's a strategy around loan forgiveness, a strategy around behavioral health licensure. As most of you know, the licensing boards rest with the Tennessee Department of Health, and I anticipate that we will have continued discussion coming out of this workforce work group with our partners at Health related to licensure issues. Let's see, more pipeline planning for public behavioral health careers. There's a strategy specific to it. Communications planning and coordination. So again, I want to be sensitive to time. I'm not going to go through all of these, but you'll have it next week. We wrap it up with a conclusion and next step section. You can see here, we have really great representation from various organizations. University of Memphis, Trevecca, Freed-Hardeman, Belmont. We had several universities, University of Tennessee. You can see here also NAMI, the Tennessee Mental Health Consumers Association, NASW. As the commissioner mentioned, Ricky from Tennessee Voices was a part of this work group. Albert from CAP, who's also our chair for the Planning and Policy Council. Tatis, Tamho. It was a really good group, and obviously appreciate everyone's involvement with working with us, and then of course the folks from our shop and TennCare who helped. So I'm going to need to take a break from all this talking. So I'm interested if anyone has questions about the report, and I'll be glad to help speak to those. Kurt, I know I ran through that really quick, and Matthew's here. Is there anything else that we should highlight for the group as it relates to the report, the composition of the report, anything important that I may have missed?
No, I think you did a great job, Matt. Thanks for walking us through this. Ricky, Albert, and Kim were as you said, the representatives from the council on the work group, and of course, other members of regional councils throughout the state were probably involved just by nature of being in the positions that they were in the work group. But yeah, this is really a reflection. Commissioner Matt really took to heart the needs assessment that y'all completed over the last couple of years in highlighting this workforce development issue. And I think you're seeing that bear fruit here with this report and with the budget proposal. And as Commissioner said, and we've said in some of our regional council meetings, this is not a done deal yet. There's a lot of work to be done before this it becomes a final budget proposal from the governor to the legislature. So if y'all support this and want to see this into fruition, then let the governor know, let legislators know when it's time.
Yeah, I think one thing I would encourage y'all to do when you get a hard copy of this report or PDF of it next week, I mean, I would take the report and look at it next to our budget request. And I think Kurt is exactly right. I mean, the timing of all this, it worked out well because we knew we had to submit our budget request, I guess, back in September. And at that point, the work group had already met. We knew that the strategies that they identified, and we did our absolute best to try to include those strategies in what we're asking for next state fiscal year. And, you know, it's going to be this group here. It's going to be our Planning and Policy Council, should we get funded to do this work, that will continue to work with us as far as implementation. I tell you, I'm thrilled about not only the cost of living adjustment that we've asked for, but the funding that we've asked for to look at, you know, college stipends and professional development. And we're going to need y'all's insight on how to make that have the most impact, and really look forward to, if that's included and if that's approved, I think that's going to be a big deal for our state. And I hope y'all are as thrilled about that as I am. That's going to be really important.
Matt, I will say the work group was strong and the leadership was good. And you guys came up with a very succinct summary of all the things that were brought to the table. And I know, as you said, this is going to be a huge support. And obviously, I think you intend for the governor to see this report because it really supports what you've asked for. But are there other key stakeholders that you intend to get this in front of?
Yeah, I mean, I think obviously the administration, you know, last week, Ricky, we had maybe 2 weeks ago, rather, we had a hearing with the House Finance, Ways and Means Committee. You know, we promised that we would send this report to that group. I imagine we'll send it to the legislative leadership. Kurt, is that right? Do you think that would be a step that we take?
Yeah, I think that's something that we would definitely consider and probably do.
Yeah. And then, I mean, you know, you all as providers, I mean, y'all using this report as a resource in your discussions. You know, the provider I referenced we met with yesterday, TDMHSAS and our department, I mean, they've been successful in working with their local government and obtaining additional resources for their work. So I really appreciate the efforts that each of y'all are making, and not only working with the state departments, but also starting to engage some of the local governments and how they may be able to partner with each of you to augment the funding that you may receive from our department or from TDMHSAS. So this report could potentially be helpful in that aspect too. All right. Well, Avis, Kurt, I appreciate y'all helping, you know, get the group together. It's really great to see everybody. And I hope I'll see some of you next week at CAMHO's conference. It's always a cool time of year because I think are they doing it again this year at the Marriott there in Cool Springs? I think they are. It's
Yes.
always decorated so beautiful for Christmas. Anyway, it's really
Thank
great to see you.
Thank you, Matt. Really appreciate you and the commissioner coming on to share this information with the executive committee. And if there are no questions for Matt, I'm going to turn it back over to Albert to conclude our meeting.
Right. And I would just note, Matt, that it's really impressive that this is so data driven to come to our conclusions and our strategies. And it's impressive. So I'm, you know, again, I'm like Rick, I'm excited that I had the opportunity to be a part. Okay. Well, we'll go back to recaps on the members attending, and Kirby, do we have any additional members who joined us since initial roll call?
I do not believe so.
Okay. Do any of the members have any comments or any topics that they need to put on the floor?
Albert, Albert,
Yes.
this is Richard over at Assport. I just want to thank everybody for lending their time and talents. I know it was exhaustive work and it took you away from other duties that I'm sure you had, but I just want to thank everybody that was involved for their hard work to get this report out and give us some leverage as we talk to our legislators here in our area to say, look, it's time for this to happen. So thank you. Shout out to all of you.
Thank you, Richard.
Hey, Richard, can I ask you a question?
Sure.
What football stadium is that on your wall back there?
It ain't but one football stadium, Commissioner.
Oh, hold up. Hold up.
Hold up now.
You see that?
No. What? Ain't nobody in there, man. Oh,
They're all on the bandwagon right now.
ain't that it? Are y'all going to do it to Alabama?
I think so. Auburn
looks good.
almost did it to Alabama. I think Georgia can.
Yeah, should be able to.
I just
Anyway.
echo what Richard said, Albert and Matt and the rest of the team about the time. I guess as I sit here and I look at everybody's faces, I told somebody the other day, it's getting to the point that I'm the elder of the group. And that's a little scary. But this is the first time I know in my 35 years that I've seen a department step up and recognize what is happening on the front line, and then going to bat to try to figure out how to help us on the front line. So thank you very much.
Well, I mean, you know, that effort and that focus and that commitment starts with our commissioner. And I think you all know that. You know, she takes heed of what you say as planning and policy council members. And certainly several of you were a part of the work group and y'all's voice was heard there. So, you know, we take heed of the feedback that you provide us, and hopefully, you know, what we put forward in our budget request next year is just one of the many examples of that. So thank you.
Thank you.
I do have one issue with the commissioner this morning.
Okay.
We didn't get a song. I always expect a song out of her, and I didn't get it this morning.
It's okay,
Well,
Kurt
I know
can do it.
All right, Kurt, you do it.
Yeah.
When you're restless and you can't sleep, just count your blessings instead of sheep, and you'll fall asleep counting your blessings.
Looky there, Kurt.
Yeah,
Yay,
yeah.
Kurt.
And
Not
Debbie,
as quite as good as the commissioner, but we accept it, Kirk.
And Debbie, I have a word. Let's replace the term and say seasoned. You're the most seasoned of the group.
Most tenured.
Yeah, most tenured and
The
seasoned.
wisest
Of the group.
of the wise.
It gets a little scary when I stop and I think about that. You know, how long I have been around.
But that's
So,
a
yeah.
good thing because you bring a lot of wisdom and knowledge to the group. So that's
I
awesome.
like seasoned. I can go with that one.
All right, seasoned.
Okay. Well, with that, you know, I want to say, as always, thanks, Kirk, Avis, and Kirby for always making this happen and go smoothly. It couldn't possibly happen that way without you guys. I really appreciate you. On wrap up, next steps, do we have anything, Kirby, Avis?
I think that's it. Of course, our executive meetings are called as needed. So if an opportunity presents itself that we need to schedule another meeting, we'll definitely do so. But other than that, I think that's it.
All right. Then I'll take a motion to adjourn.
I'll motion to adjourn. Oh, sorry.
Do we have a motion?
So moved.
Second?
Second.
All in favor?
All right.
Aye.
Ayes have it. We'll see you guys later. Be careful.
Thank y'all.